We're now being joined by Dr. Sunday Atinko, who is a surgeon and the former treasurer of the Nigerian Medical Association in the Federal Capital Territory. Very warm welcome to Newsnight.
Thank you for having me.
When you listen to that report and you see the number of times Nigerian doctors and health workers had gone on strike, you'd just be amazed that is this not against the autocratic, oath that they practice and the rest in the face of the daunting challenges, you understand, that, you're confronted with?
Thank you so much. Yeah, I like the word daunting challenges that doctors are confronted with, health workers are confronted with. And it is based on that we embark on this industrial action. The reason being that we need to fix the health sector. And if you don't keep calling government attention to burning issues to fix the health sectors, they never get to listen. And then the Nigerian patient suffers. And when doctors negotiate, discuss, appeal, lobby, they will have no option than to go on strike. And it's only when they go on strike that the government listens to them. And in fact, like was reported now, the last strike was over 2 months, more or less. And yet it took that number of time for government to come to terms with what we're talking about. And let me tell you, it is high time government begins to show significant responsibility to the health of Nigerians. You cannot just make the Nigerian health a trivial issue. Nigerians are dying in droves. In fact, this law or this bill that is in the offing now is a disaster. And for a lawmaker to make this kind of bill, it should be embarrassing. I was thinking that they should be enacting bills to see that our health sector works. Hospitals are not working. We have dearth of equipment. Personnel are in droves leaving to other shores of the country. And we're talking of how to, mitigate strike.
Don't you think it's out of frustration, if I may come in here, out of frustration about the incessant strikes, that Christian referred to? What are your thoughts? You were going to, make a point on the issue of the law, but these incessant strikes, don't they go against, or negate the code of medical ethics provided by the Medical and Dental, Care Association of Nigeria?
Well, it doesn't negate, because the very reason why we go on strike is not even for remuneration. Fix the health sector, give me things to work with, provide equipment. In fact, if I may go, in detail, in this country, in the whole of Nigeria, there's no PET CT scan. Nigerians are leaving this country to go and do PET CT in India, in Europe. And how much is a PET CT machine? $3 million, to say the highest. $3 million.
What does that do?
To at least, if patients, you want to stage a disease, stage cancers, you scan patients, tell you exactly the extent of diseases, and then you give the appropriate treatment. Oncology care is assessed abroad just for PET CT scan. And you know what? We pay almost of £100,000, sending top government functionaries like that lawmaker who is enacting that bill, so to speak, over almost £100,000 to go and see an oncologist. And yet we have replete oncologists in Nigeria. So this is a system that is not serious.
Yeah, but these strikes have gone on over and over again. Have they achieved the desired goal? It doesn't seem they have, because you're planning to go on strike again at the slightest, opportunity. But it seems NAD, resident doctors, and the General Doctors Association,
NMA.
the NMA, are lumping, states like Abia, Imo, Ondo Ekiti, with who are owing
doctors,
yes, with others who
government
may be doing all they can, within their ability to meet your demands.
Let me be sincere with you. As much as we appreciate government effort, but what government doles out to the health sector, let's look at the Appropriation Act of 2021 and 2022, less than 5%. And the Abuja Declaration in 2001 said 15% at least of government budget on the list, and you give less than 5%. And do you know, in 2021, budget was 196 billion. What was National Assembly budget? 134 billion. So the whole health sector, both recurrent and capital expenditure for the health sector, 196 billion naira. And yet, National Assembly, for the largest they take home, 134 billion naira. So it tells you where our priority lies. And let me appreciate the media, the fourth estate of the realm. You see, you need to begin to call government to question. You need to begin to hold government accountable. Nigerians need to begin to wake up and ask government questions. What do you do for us as Nigerians if you cannot avail us tangible health? The earlier we wake up, the better. You sit here today, the day you are challenged by serious health issues and you can't afford funds to fly abroad, you are finished. So this is a serious matter.
But it was one of your colleagues as minister that said the other time that you don't, you know, as a doctor, you don't need to practice. You can be a carpenter or a tailor or a fashion designer and the rest. Are doctors, excuse me.
I will not dignify.
Excuse me. Are doctors good administrators? Because you insist that the health ministry must be headed by a doctor.
Okay.
And you do have a medical doctor now.
As a consultant, as a specialist, you have been trained to administer the health sector. So there are people who, born out of their own idiosyncrasy, they fail in administration. It doesn't mean that doctors, as an umbrella, cannot administer. I hope you get what I'm saying.
Yes.
Oh,
so
late Professor Likoye Ransom Kuti
excellent administrator.
Yes,
excellent.
Very excellent.
And he focused a lot on
Yes.
primary health care, where
and
it
it is
really
the
mattered the
foundation
most.
he laid.
But help us very quickly. What are those demands, if you can itemize them very, very quickly, the low-hanging fruits? Which ones have government met you halfway on? And which ones have not been met?
You know, government, I'm not here to discuss demands. What we are here is to
looking
discuss
at the
this
legislative bill.
This
That's
bill,
right.
what sense does it make that a lawmaker sees the gamut of challenge bedeviling the health sector, and all he thinks about is how to nip strike, and without that strike, perhaps his elderly mother in the village may not be accessing proper health care. And so what I expect lawmakers to talk about now is, what do we do to engender our health sector? What do we do, you know, to agitate, to titillate our health sector to the level that it delivers proper, reliable, accessible health care to Nigeria? If you don't make that law, then you are fixing the problem from the feet.
Okay, Dr. Sunday Atinko, a surgeon, we really appreciate your joining us tonight, and we appreciate all health workers and doctors like yourself.
Absolutely.
Thank you for joining us.
Thank you so much.